Hi everybody, my name is Diana Soto. I am a student through Indiana State University's LPN and BSN program. Today I'm going to be talking about hypothyroidism. The following are some of the learning objectives I would like the audience to learn throughout this presentation. So the first one, I would want the audience to learn what is hypothyroidism. Number 2, the audience will learn signs and symptoms of hypothyroidism. Number 3, the audience will learn risk factors of hypothyroidism. Number 4, the audience will learn how hypothyroidism is treated. Number 5, the audience will learn how you are tested for hypothyroidism. Number 6, the audience will learn what can happen if you do not treat hypothyroidism. And number 7, the audience will learn a little about primary and secondary causes of hypothyroidism. Before you begin the presentation, be sure to click the link below to begin the pretest. What is hypothyroidism? So hypothyroidism is when your thyroid gland does not produce enough thyroid hormones. It can cause this to be underactive. This may slow down many bodily functions, like your metabolism. So you may be wondering, what does your thyroid gland do? And how is this affected with hypothyroidism? So the thyroid gland, this is a butterfly-shaped organ that is located in the front of the neck. So you can see that here in the picture to the left, that butterfly orange-shaped organ. That is your thyroid gland. So it's located under the larynx of your voice box, and it hugs around your windpipe. Its main function is to help control your metabolism, which makes food to energy, essentially. Your body temperature and heart rate are controlled by the thyroid gland as well. The thyroid helps make and create hormones. The pituitary gland is what controls the thyroid hormone. So the pituitary gland can adjust to high and low levels by its hormone called the thyroid stimulating hormone, or otherwise known as TSH. The TSH is what they test in a person to see how their thyroid gland is functioning. So this can be done by a blood test at your doctor's office, and they would check the hormones T3 and T4, which are produced by this thyroid gland. High TSH would indicate hyperthyroidism, and low TSH would indicate hypothyroidism. In this presentation, we are talking about hypothyroidism or low TSH. The following are some symptoms of hypothyroidism. You may feel more tired than usual. You'll probably experience unexplained weight gain. You would be unable to tolerate cold temperatures. You may experience numbing, tingling feelings in the hands. You may be constipated. You may feel like your body is very sore. Lab tests may indicate higher than normal cholesterol levels. You may be feeling depressed or have some depression. Your hair on your body would be coarse, dry, and as well as your skin. You may have, for women, you may have frequent and heavy menstrual periods. Your face may appear puffy as well as your eyes, and you may have droopy eyelids, or you may feel foggy. So who is affected by this disease? Hypothyroidism can affect anybody of any age, gender, or race. It does not discriminate. Typically, women over 60 are the ones who are commonly affected. Especially after menopause, this can develop. Hypothyroidism can also occur during or after pregnancy. So what are some causes of hypothyroidism? So hypothyroidism can be considered as a primary or a secondary cause of this disease. So primary causes of hypothyroidism typically cause or create low levels of thyroid hormones. So this directly affects the thyroid. So essentially your thyroid would be the one that's not producing enough hormone. For primary causes, these are typically more common than secondary. So primary causes is typically seen as an autoimmune disorder called Hashimoto's thyroiditis. So this can occur during pregnancy or just in somebody who has hypothyroidism. Secondary causes happen when the pituitary gland fails. So the hormone TSH that is produced by the pituitary gland in your brain cannot balance out the thyroid hormones. So how is hypothyroidism treated? Treatment includes making sure that you are replacing the hormone that your thyroid gland is not making itself. So you would take a medication, which a common one is called levothyroxine. You would take this medication orally once or twice a day to help balance out your thyroid levels. The disease is a manageable one. You would need frequent labs and checkups with your healthcare provider, which are crucial to make sure that your thyroid levels are in a therapeutic range. So sometimes it takes a little bit of trial and error, essentially, to get your thyroid level under control. Your doctor may change your doses every couple of weeks or every couple of months to help make sure that your thyroid hormone levels are within a good therapeutic range. So what happens if you decide not to treat your hypothyroidism, or maybe you just don't know that you have hypothyroidism? Some things that can develop are things like mental health problems. You may notice that you're having trouble breathing. You may be unable to maintain a normal body temperature. You may develop heart problems, or you may develop a thing called a goiter. This is a thyroid gland enlargement in the thyroid gland in front of your neck. So the child in the picture to the left, you can see that they have a lump in front of their neck. This is due to an iodine deficiency in the diet, and you would essentially develop a goiter. And this can happen also if you don't treat hypothyroidism. Something else that can happen if you do not treat your hypothyroidism is something called myxedema. So this is a very severe, life-threatening form of hypothyroidism. So you may see signs and symptoms of a low body temperature, anemia, heart failure, confusion, or even a coma. This is a very serious condition and you would need to be treated right away. Thank you for watching my presentation on hypothyroidism. Be sure that you click the link below to begin the post-test. On this slide, I have several references that would be good for you guys to go into to discover a little bit more about what is hypothyroidism. You can go a little bit more in depth about causes, risk factors, treatments, signs and symptoms, etc., to help yourself learn a little bit more about this disease.